I've been here at Guthrie for 19 years. I came right out of my residency and wanted to practice rural medicine because I wanted to take ownership for the care of my patients, to be in charge of their care. My name is Dr. David Pfister, and I'm a family medicine physician at the Guthrie Clinic. I have a strong belief that as primary care physicians, we know our patients best and are in a position to guide them through a complex maze of medical choices. A well-trained primary care physician can manage most of their patients' care. I have a 5-minute commute. I'm part of the community. People recognize me even if they're not my patient. Here, physicians are still a respected part of the community. Just last week we went out for ice cream, and not only did 4 of the 6 people at the stand know me, but they also knew my son and that he had just left for basic training. That's the thing about rural medicine. You can't go anywhere without seeing someone you know. In my free time I make furniture. I have a workshop in my basement. Woodworking is what I do in the in-between seasons when it's not warm enough to go biking and not cold enough to go skiing. The relationships that rural physicians have with their patients are a little deeper than you would have in a different environment. In other healthcare systems, you may have a patient with 5 subspecialists. Nobody is taking care of them. No one is steering the ship. Just the other day I had a patient come in, a 2-pack-a-day smoker. The patient was clearly in trouble. I sent a message to one of our pulmonologists. He said, "We could do A, B, C, or D, but if we just do B, I can do it right in my office." He wanted to do the right thing for the patient, taking into account her individual situation. Guthrie offers multiple practice environments for different interests. We have everything from 1 or 2 practitioner rural offices to multi-provider offices with full-time and visiting subspecialists in small towns and small cities. Some offices treat outpatients only, and in other offices physicians still provide hospital care. This is all supported by our family practice residency, where physicians teach residents and provide inpatient and outpatient care. Guthrie helps me practice medicine better. First, there are lots of folks I consider colleagues amongst the medical staff. There are no turf battles. Specialists are willing to give their opinion on cases. Physicians at Guthrie buy into the core values of patient-centeredness, teamwork, and excellence. Guthrie, being a physician-led organization, does put a different spin on how you view patient care. The first line is not the bottom line. The first line is, what can I do for the patient? We're not mired in CEOs watching the cash flow. We're grounded in patient-centeredness and led by physicians. I think it's a model with minimal politics. If physicians want a voice, they have the opportunity. We're fairly fiscally conservative, which makes us comfortable and will allow us to ride out the chaos and changes ahead. What differentiates Guthrie is the long-standing nature of our integrated group. We came together to serve patients better. Other groups are coming together out of expediency. They are driven by insurance plans or medical schools. But we are driven by the needs of the patient. Primary care physicians are not all things to everybody, but they can be most things to most people.